The first shock, I'm going to group them together because first is compensated, then it's decompensated and irreversible. Kind of runs in a chronological order. And compensated shock is the first stage of shock that the body is going through. The body believes it can fix itself and maintain homeostasis. And this activates the sympathetic nervous response, where everything is elevated in the body with heart rate. The respirations might increase a little more to get more oxygen into the body and to help with perfusion. The body's goal is to keep perfusing even if there's a lack of something in the body that's not allowing it to perfuse. In this case, I don't know if you can hear Mia. She's very hypersensitive and she wants to go play. So her hypersensitivity, you would see that in patients in compensated shock. And basically, treatment for that is to perform ABCs very well, transport them, give them high flow oxygen, and get them to the hospital sooner rather than later. And if you need to, contact ALS support unit. Compensated shock is not fixed and it turns into decompensated shock. That's basically the late stages of shock and the body is unable to fix itself, where this is where you would need advanced help. But a lot of times once the body goes into decompensated shock, there is not much EMT level that we can do to reverse it. So like I said before, the level of treatment should be maintain ABCs very well, check vitals, and then always check vitals on everything for shock, because the blood pressure will tell you a lot. And after a while in decompensated shock, the blood pressures then continue to fall, and ultimately fall until you get them to the hospital where they could try doing different things. If the worst case scenario to have is irreversible shock that has progressed to a terminal stage, which is basically the Walking Dead, as we heard in our lecture. There's not much we can do other than transport them rapidly and contact ALS to see if they have any ideas or if they can take over patient care, depending on transport time, along with obviously for EMT level to perform ABCs very well and maintain their open airway and give them oxygen and breathe for them until you get to the hospital. Other than that, compensated shock is like stage 1, like I said. Stage 2 would be decompensated shock, and irreversible would be stage 3. And then death follows shortly after irreversible. That is the end for shock. And thank you for listening.